A dangerous new strain of whooping cough is behind a sharp increase in the number of cases of the disease. Last year, more than 38,000 diagnosed cases of the illness were reported. That's the highest number since records began in 1991. Professor Gilbert is from the Centre for Infectious Diseases and Microbiology at Sydney's Westmead Hospital, and she's part of a research team that's been analysing samples taken from patients in 4 states and says the prevalence of the new strain is a bit of a mystery.
What we do know is that it's different, and it's different from the strains that have been used traditionally to develop to make the vaccine. And it's this difference that is probably important, because what we hypothesise is that the new strain has, if you like, escaped from the vaccine protection by changing itself so that people are no longer protected as well as they used to be by the vaccine.
And the new people who were infected with this new strain, were they vaccinated against whooping cough?
Some of them have, and they usually get very mild infections. The problem is that they are then infectious, and they may not, nobody may actually realise they have whooping cough, and they can be infectious and then infect people who are not immunised, and that particularly applies to young babies before they're old enough to be immunised. And that's the main problem, because it means that there have been increased numbers of cases of babies admitted to hospital with whooping cough over the last few years.
So does this tally with a fall in the number of people and children who have been vaccinated?
I think the rate of vaccination is actually good, and it's certainly the numbers of cases are less than there would be without vaccination.
So does a new vaccine need to be developed?
Well, I think this is something that we really need to start discussing. This evidence is not completely new or unique. Similar sort of trends have been demonstrated overseas, but Australia has a particular problem with increased notifications, and it's possible that there are other factors related to that. There's greater awareness of pertussis in the community and by doctors, and so there's more testing being done. But I think it certainly does coincide with the increase in the number of these new strains, suggesting that there is a need for a change in the vaccine, or at least a change in the schedule.
Professor Gilbert, thank you.
Thank you.